Hi, my name is Matthew Radant, and I am practicing at St. Francis Hospital in oral maxillofacial surgery as well as head and neck surgery. My decision to become a doctor, I had always been interested in helping people, and throughout high school and college trying to find that area. And so, of course, going through shadowing multiple different dentists, doctors, I made the decision to seek patient care, especially in the surgical field. I had always grown up working with my hands, whether it be projects around the house with my dad or growing up playing sports, and so I knew something in the surgical field was right for me. I originally went to dental school, and as part of dental school, afterwards you can do residency in oral maxillofacial surgeries. So after residency in oral maxillofacial surgery, I did a fellowship in head and neck oncology as well as microvascular reconstructive surgery. So what that does is it specializes in more so malignant or cancer pathology, but also some benign tumors, and then the complex reconstruction where you take transplants from the patient's own body to reconstruct the areas of either the mouth or the face that are affected by the tumor itself. As far as my approach to patient care, it's very individualized. Everybody's different, everybody has a different condition, emotional state in life, those types of things. So it's really not only assessing the patient's pathology report or their CAT scan, but really assessing them as a person and seeing what would be best in their particular instance to treat them as best as we can. So my goals as a surgeon are not only to treat the patient's cancer and ideally cure the cancer with surgery, but also reconstruct them in a way that will, from a functional and aesthetic standpoint, allow them to go about their life with minimal effects. At St. Francis, we do our best here to limit those effects both on the patient and their families.